Hi, this is Josh, pharmacist with pharmacisttips.com, here with an overview of doxylamine, the medication, the common over-the-counter medication doxylamine used for sleep. As with all my videos, for informational purposes only, speak to your healthcare provider with specific questions. So what is doxylamine? What it is, it's a antihistamine actually. It's a first generation antihistamine. So one of those older allergy medications, but it's used because of its side effect. It's used for insomnia as its main side effect is drowsiness. In the US, we see it sold under the brand name Unisom. There are different formulations of Unisom. So the orange box is the doxylamine. Many generic products are available as well. It is sometimes used with vitamin B6, pyridoxine, to treat nausea in pregnancy. So we would call that an off-label use, but we do see that used frequently. So doxylamine dosing, it's indicated for 12 and older. It's one tablet about 30 minutes before bedtime. Of course, we want to avoid taking that with any other sedatives, any other medications that cause sedation, any alcohol, things like that. We need to contact a healthcare provider if we need it for more than 2 weeks in a row. Just make sure that there is nothing else going on there that requires medical attention. Some of the warnings and cautions, as a whole, medication is tolerated really, really well, especially when used occasionally. But we do need to be cautious in folks with asthma or existing breathing problems. Sometimes that anticholinergic effect of these older antihistamines can worsen breathing in certain people. It can also increase the pressure in the eye in some folks with glaucoma, so we need to be careful there. And if we already have existing urinary flow issues, prostate issues, bladder obstructions, it can further impair that urine flow, so that population should probably avoid these types of medications. Some of the side effects, obviously, dizziness, drowsiness, that is what it's used for. Those side effects are why we use this medication to help us sleep. However, sometimes it can cause some restlessness or nervousness. So if that occurs, you can't tolerate the medication, obviously, and it's best to avoid it in the future. Headache and fatigue can occur, dry mouth, constipation, nausea, and then rarely we can see some chest tightness or low blood pressure. Also rarely some heart rate issues, tachycardia, palpitations, and urinary retention, which we already talked about. So I appreciate you watching. I hope you found this information useful. I'd appreciate it if you would like this video and subscribe to my channel. Thanks again for watching.